Hi guys, today's video is for option sports medicine. Focus question 1, how are sports injuries classified and managed? And the dot point that we'll be looking at is the first one, ways to classify sports injuries. So firstly, let's have a look at the syllabus dot point in terms of what students need to learn about. So students need to learn about the ways that sports injuries can be classified. So there are two main ways, and these are either by the cause, so these include the direct and indirect injuries as well as the overuse injuries. Injuries can also be classified by the type of tissue that has been affected by the injury, and these would include soft and hard tissue injuries. So let's have a look at what students need to learn to do with this information. And we're very lucky that this first dot point is quite straightforward in that students just need to identify specific examples of injuries that reflect each of those 5 classifications. So while you're going through this video, make sure you're writing down the definitions as well as examples of the different types of sports injuries. First way we can classify sports injuries by their cause is a direct injury. And these are caused by external forces, which means forces from outside of the body. It can include the direct contact with another person, so if a person is tackling another person and their knee collides with the other person's knee, that may result in a contusion, and they could have contact with an object such as a ball or a bat, which could leave a contusion or even a laceration, or even the playing surface falling over may cause an abrasion to the athlete's skin. Other examples could be blisters, and even a dislocation could be included in this. An indirect injury is also another way we can classify sports injuries, and these occur from internal stresses that are placed on the body. So it's from a force from within, and when this force becomes too great, an injury may occur. Examples could include falling and placing your hand out, resulting in a dislocated shoulder because the force has travelled up to the arm and caused this injury. Poor technique or overstretching could be another example of an indirect injury, and this may cause a hamstring tear. So let's have a look now at a hamstring tear and a short video of this.
It's Jones and O'Feely. It's Jones and O'Feely and Perdita Felicia, the two-time world champion, Felicia.
So another way that we can classify sports injuries by their cause is an overuse injury. And this is damage to a bone, muscle, ligament or tendon as a result of excessive and repetitive stress without allowing enough time for the body to heal. So this usually occurs in a repetitive motion. So things like swimming, running, jumping, where an athlete is repeating that same motion, and this can cause issues with the bones or muscles, ligaments or tendons. This could be shin splints, which causes pain at the front and side of the leg. Also tendonitis, which can occur in any tendon of the body, but most common ones are things in the Achilles tendon, so Achilles tendonitis, or also we've probably heard of tennis elbow, not necessarily just tennis players, but those people that overuse that elbow joint and can cause inflammation of the tendon, and which causes pain. Another way that we can classify sports injuries is by the tissue type. So a soft tissue injury occurs to any tissue in your body other than bone and teeth. So for example, skin, muscle, tendons, ligaments and even organs. So there are a couple of examples. We can see muscle tears, and that we've got a grade 1, 2 and 3 type of tear there. We've also got a blister, and we've also got an abrasion on the hand. I'll give you a short bit of time just to try and write down some other examples of some soft tissue injuries that you may know of. Okay, so let's have a look at some examples of some soft tissue injuries now. So for skin, These could include blisters, abrasions and lacerations, muscle injuries, tears, strains and contusions. Tendon injuries can also occur with tears, strains and tendinitis, and ligament injuries are those sprains and also tears of the ligament. So hard tissue injuries occur to basically bone and teeth. So we have examples such as fractures, dislocations and bone bruising. And we have a couple of examples of an injury. So we have a fractured ankle, and we also have a broken tooth. I'm going to watch a short clip for your video, but make sure that you complete the homework sheet, ways to classify injuries.
These can be classified into different categories. A direct injury occurs when the body makes contact with an external object, another person, or the ground. For example, you can dislocate your finger if it's hit on the end by a ball.
Direct injury is one that might occur, such as a contusion, where when you're watching football, someone gets knocked by another footballer and they get a contact on their leg and they get a direct injury to that leg.
An indirect injury is caused by forces inside the body, such as excessive strain on the muscles and ligaments.
It may be when they strain a muscle and they're swinging through in the late phase of running and they strain that hamstring, which we see so often in football and hockey these days.
Overuse injuries occur when specific body regions are used over periods of time, particularly when the movements are repetitive and low impact.
Some of the other injuries I've had are sort of bursitis, so shin splints and inflammation of some of the ankle joints as a result of all the jumps training that I do.
A soft tissue injury is an injury to any tissue except bone and teeth. For example, it could be a muscular or skin injury.
You know, during the season you've got calluses on your hand. Starting the season even after 4 weeks, so you get a whole heap of new blisters and stuff like that.
Hard tissue injuries are exclusively injuries to bone and teeth.
And that's the video on dot point 1, how sports injuries are classified.